Hello everybody, and thank you for joining. Now, of course, telehealth has never been more important than now, for two reasons. First of all, because dealing with the coronavirus is taking every single resource and every single possible thing that we can use. But also, at the same time as actually dealing with the coronavirus itself, people are terrified of going to the doctor or going to the hospital unless they really need to. So being able to do this from your safety of your own home really is more important than ever. And today we're going to talk to some of those leading the way in this area to really see how change has been able to happen fast and exactly how things may look moving forward. So to join me are Kate Ryder, CEO of Women's and Children's digital health platform Maven, Jean-Charles Samuelien, co-founder and CEO of digital health insurance provider Alan, and Ali Parsa, founder and CEO of Babylon Health. As Brent said, we're going to chat for about 30 minutes. Then after that, there'll be Q&As. So please do put forward any questions that you've got. So just to start off, if each of you could just introduce exactly what it is that your platforms do, for anybody who doesn't know, I'm sure most already do, and exactly how you've needed to adapt at speed to the situation now. So Ali, can I start with you?
Sure. We try to do deliver most of the healthcare most people need on devices they already, most people already have. By trying to make healthcare as accessible and affordable as possible. I guess accessibility is easy. As I said, as long as you deliver most of the healthcare most people need on platforms or mobile devices they already have, that's highly accessible. The problem is there's no accessibility without affordability. And when you look at where the costs in healthcare are, they're fundamentally in people, doctors, nurses, healthcare professionals are usually take 2/3 of the expense in healthcare. And then it's in timing. If you cut it differently, 70% of all our costs are in predictable, preventable diseases. So we spend a lot of time trying to automate as much of healthcare as possible on one hand, and monitor our members and try to predict their situation a little bit earlier than normally they will go to a doctor for, to try and give them a lot of healthcare up front so they can save on the crisis and the emergencies, which is the expensive part of healthcare.
And you've actually made available a chatbot to everybody, haven't you? Not just people who use Babylon as their GP. Is that one of the changes that you've made at this point?
So our chatbot has always been freely available. Most of our apps, if you want, our technology are freely available to everybody. Anybody can use it at any time they wish. The only part we charge for is when we have to pay for clinical services. So if we are your GP, in Britain, as you rightly say, or if we provide clinical services to you, doctors, nurses, pharmacists, whatever it is, we have to charge for those because obviously we have to pay for that. But the beauty of technology, as you know, is that while we have to spend a very large quantity of money to build it, the incremental cost of delivery is very, very little if it's only digital. So we try to not necessarily charge for those.
And on to Jean-Charles, could you tell us a little bit about Alan and how you have adapted in this time of the coronavirus?
Yes, so hi everybody. Alan started with this mission that we think that healthcare should be friendly, fair, and frictionless for everyone, and everybody should access to it in a very friendly and frictionless way. And in order to do that, we want Alan to become the gateway to the healthcare system for people. So the only app you use to access prevention, to access delivery of care. And in order to do that, we decided to start with one of the biggest building blocks we believe in the system, which is a health insurance company. So we are a full stack health insurance company in France, and we are now growing in Spain and Belgium. So we are going to be pan-European. And we believe health insurance is very well placed because it is at the intersection of every stakeholder, being the end users, doctors, pharmacies, hospitals. So we are this central platform that redistributes the information and redistributes the care. It's been 4 years. We cover 80,000 people in France, mostly through companies. So we have more than 5,000 companies with a delightful health insurance experience on more and more healthcare services, such as telemedicine, prevention, with proactive care notifications, or a map of doctors that allow you to find the right doctor for you. And during the crisis, we did a few things that we thought were really important. One thing is that there was an overwhelming amount of information, and we have a lot of customers who are like HRs of companies, and those human resources, they were totally lost on how to handle the crisis. So the first thing we did is that we built a conciergerie service plus really great and tailored content to help them. What else we did for them? We delivered masks for every of their employees. So with 2 clicks, they could get access to masks for free. We sent vitamins to the employees of a few companies so they could go through the crisis. And we built a few digital tools such as unlimited telemedicine, so you can talk with a doctor free and unlimited. Access to a symptom checker, so you can assess your risk and know how to go and where to go in France and who to speak to. So it's the kind of thing we have tried to make accessible to our members. And we have also created a free insurance product. So like you could sign up in 2 minutes for free and get access to telemedicine, meditation app, integration with Headspace, for example, for free.
Okay, so it's getting everything in one place. I think there's a lot of aspects of this that would be great to come back and talk to about trust, about people giving over their data, which we'll do in a moment. But let's just have Kate introduce Maven first of all. Kate, could you just tell us a little bit about the platform and why it's so relevant at the moment? It must be a terrifying time to be having a baby.
Yeah, I think childbirth in a pandemic sounds like a horror movie. So there's a lot of anxiety there. So I'm Kate Ryder. I'm the founder and CEO of Maven. Maven's the digital clinic for women and families. So I actually founded Maven in 2014 in London with the mission to build a more inclusive healthcare system, for women and the families at the center of it, with more support as they navigate the pathway to parenthood and beyond. And today we work with over 5 million members across many global employers, from small startups to multinationals, supporting their offices in dozens of countries, offering our digital pregnancy, fertility, adoption, surrogacy, return to work, and pediatric programs for their members. And as part of subscribing to our programs, members get access to our award-winning telemedicine network. It's the largest women's health and pediatric telemedicine network in the world, with more than 2,000 providers across 20 specialties like OB, pediatrics, reproductive endocrinology, doulas, midwives, lactation consultants, mental health provider, available on demand and 24/7. And so throughout COVID, I mean, what we've seen is, routine prenatal care has been massively disrupted. Routine pediatric care has been massively disruptive. And so we launched, both fast track 6-month programs that employers can roll out, without signing a big 3-year contract with, across all of their family programs, to just get our telemedicine into the hands of their employees as quickly as possible. We also have been hosting, weekly webinars with our, fertility doctors, OBGYNs, and pediatricians to talk about, what to do. The guidance is changing almost weekly. And then we've also, we're working with, we just rolled out, the state of Massachusetts to their state Medicaid program, to really help women and children get more access just to our telemedicine during this time. So lots of different movement during COVID.
As you said, the guidance is constantly changing. All the information is constantly changing. Obviously, we're seeing science unfold in a way that normally goes on behind closed doors, and you don't know anything of it until there's actually some sort of satisfactory conclusion reached. But in terms of evolving as companies and with the products that you provide, how simple or difficult has that been throughout this process, especially for things that are medical that would normally take a lot of time to get approval? Have you found that you can make the changes easily that you want to make available the services that you want?
I mean, I think that in the US at least, there's just been a lot of roadblocks to telemedicine reimbursement, and a lot of regulatory roadblocks have actually been removed over the last few months. So if anything, I think a lot of the telemedicine companies were already set up to deliver this care at scale, and were just, sometimes hindered by, Medicaid reimbursement laws, for instance. And so now actually, with a lot of the regulatory roadblocks removed, I think telemedicine businesses are now able to show exactly, how well they can deliver on modern and efficient care delivery that's the same quality as, going to the doctor in person, if it's for, a non-urgent need.
Yeah, and of course, a lot of this progress is really going to pay off in the post-COVID era, which seems hard to imagine right now, but hopefully won't be too far away. First of all, if I could just start asking a few different questions to all of you. The mentality of tech companies is often to be quite malleable, to change things at speed, to be able to provide things for a changing world all the time. Do you think that you are at an advantage over non-tech companies to really be able to give people what they want right now? Ali, maybe if you want to start with that.
I think that is true. And in our sector, the non-tech companies are very valuable organizations that provide phenomenal services. So it doesn't give me any joy to say necessarily that that is true. But if you just think about our response to COVID, because I think it's a good example of this, what we saw immediately after the outbreak was a massive influx of demand that almost blocked our emergency rooms across the world, or wherever it was that it was happening. So you saw what happened in New York, for instance. We also saw that the telemedicine providers, including our telemedicine provision, got swamped. Like the waiting times went from a few minutes to a few hours, and at some stage to a few days. So what that showed you is that a doctor is as rare behind a mobile phone or inside as in an emergency as they are inside the clinic. So what we had to do was very quickly to build a series of stratified ways of helping people. So first we said, look, if you have a question, let me answer your question in any way that I can. So we produced, for instance, at the very early days, a video that has now been viewed 2 million times. On the early days was 100,000 times a day. On how do you wash your hand? Because we're getting people calling our doctors saying, hey, they all say, wash my hand. How do I do that? The second part was, if you are going to have symptoms, you go to a doctor and ask questions, but those doctors follow very strict protocols. So let me digitize that protocol, and we gave it to our users. Then if those people were at home, we needed to monitor them. So we did this again digitally. And then they had a whole bunch of repeatable questions. So we put a whole bunch of people up who live chatted with them. They were clinically, if you wish, clinically supervised, but they were not necessarily clinicians. And anyways, eventually we gave them to a telemedicine doctor if they needed to, and in very rare occasions, we send them to emergency. With doing that, Lara, we ended up reducing the demand on our doctors in a space of 2 weeks by 80%. And it is incredibly hard for a non-digital organization to do that. So we now have actually less teleconsultations than we had before this thing started, that we have 3 times more members that we are serving. So I think that gives you a great example, and it's significantly cheaper, right? To deliver something digitally is only 50 pence. To deliver it, a chat is $5. To deliver it with a doctor, telemedicine, let's say $50. And once you go into a clinic or emergency room, it's anywhere from $500 to $5,000. And that is the beauty of digital. I hope that example gives an answer to it.
Yeah, well, I think I've been covering telehealth for 9 years, and I think one of the things that I've really seen over that time is that even if people are happy to engage with it, often when it comes to the tracking of conditions or whatever, they don't necessarily trust that information to be looked at, and they worry about their data. There have been so many concerns that I think have been the hurdle to actually move forward over the years. But right now, people so want something to work, and they want something that they can use from home. It feels like there's a bit more willingness, and maybe people are a little bit less worried about their data than normal. Do you think there's some truth in that, or is that just an optimistic idea? Because when you look at contact tracing, people still seem very concerned about their data.
So I think Lara, you're right, but the problem with adoption of technology almost always was cultural. It was never technical. I mean, our technology has been improving bit by bit over the last few years. Everybody on this call is more qualified to talk to me about it than me. But the reality was it was always a cultural issue. And what we saw very quickly was that when people tried it, they said, look, why would I ever do that? I mean, forget about the pandemic. You're ill. You have, let's just say you have a temperature, normal course of events. you have a temperature or you have an infection. I mean, think about this. I mean, you gotta get out of your bed, get onto the road, sit in your car or in the bus, get to the doctor's place, wait in one of the most infected places on earth, alongside all sorts of other
yeah, I agree with
people.
you.
Eventually, I mean, it just makes no sense, right? So this was never a technical problem. This was always a cultural problem. And now that I think people have used it, they're never going to go back. But it also has shown that telemedicine alone is not going to solve the problem, because a doctor, as I said, behind a mobile phone is as expensive and as rare as a doctor in a clinic. So we need to actually now start automating those processes as fast as people are adapting them.
Yeah, of course. And of course, doctors are still playing an absolutely vital role in when people are tracking a lot of conditions. The doctor is still needed to be looking at it all. I certainly don't want to take them out of the equation. But do you think with the platforms that you're running, do you assume a certain level of common sense from people? Because people have a huge variation in common sense. And the expectations of some people to go to the doctor, some people might feel satisfied if they're told to drink lots of fluid and take some paracetamol when they leave, whereas others would be left feeling deeply frustrated. And why did they risk all those germs for that sort of answer? So what sort of thought process goes into the creation of a platform so it appeals to all without patronizing the intelligent? Shall we ask this one to Kate first?
Sure. I think, with our specific population and demographic, which is, typically millennial women and young millennial families, they're just operating without information and heightened states of anxiety with a lot of needs. And so actually we find our market as a great entry point into building that bridge of trust, because the existing system, there's not actually a lot of options in general, and it's so underserved. And so even something as simple as like a sleep coach for a crying baby, if you're an exhausted parent and you have no other resources to get your child to sleep, you're going to actually try telemedicine, try these new digital health platforms. And I think, I think in general, that kind of starts to build, the bridges of trust.
And I suppose there's a lot of reassurance that comes with that as well. And sometimes people just want to speak to someone from a medical perspective to be told it's all okay, don't worry, that's normal.
Yeah, I think we see we track rates where if someone reads an article or piece of content, but then hears the same thing from a doctor, they'll listen and change their behavior. So it really does come down to that personal connection that you can build virtually.
Yeah, totally. And trust. And to you, Jean-Charles, how do you feel that how willing are people to provide their data? How willing are they to trust a platform? Do you think people ask a lot of questions, or do they accept aggregated data is more valuable and any use that's taken from data, it's anonymized first? What do you feel the attitude is right now at this point?
I feel that it's really good question that people should ask. And I think our job as a healthcare company is to push people to ask that question about data, how we treat it. Like, we have a responsibility to do that very well, because if we don't do that very well, it's going to slow down the adoption of telehealth at some point. So I think we need to do that better than in other industries. And we see very different behaviors. And you have a large spectrum for people that really don't care to people that really care to not being tracked at all on healthcare data. And I think for us, it's about building you have the Hippocrates for doctors, and I think we should have the same thing for health platform, where we are going to define how we are going to use the data of our user, and we should not sell that data. Us as an insurance company, we should not use that data to individualize pricing. We want to align incentives with our members. So we want to tell them, if you share with us more than less, we are not going to change the price. We are just going to give you a better user experience, better services, better information. And that I think is really, really important, to really align interest between the user and the company, and to show that they will be safe. And when you see, the last thing is about security. And I think we have a huge mission there. When you see the number of leaks in the US every year, it's in millions. We need to be very careful about that. So yeah.
And it sounds as though really people feeling there's a sense of transparency is the priority there. And if they feel that, you're more likely to get stuff from them.
Yeah, I think we need to push GDPR forward even. Like GDPR is about prior consent. And I think in healthcare, we should really ask before explain why we are going to use the data and what are going to be the results. For example, for our proactive care. So if you didn't go to the dentist for like more than 1 year, Alan is going to share with you like the dentists around your office or your home that are totally reimbursed by Alan. But we ask proactively, can we use your data in order to do so?
Yeah.
And I think it's really important.
How people feel about that is probably how much of a benefit they feel it is. Because if you feel you're getting something for it, you don't mind giving your data. But if you feel like you're just trying to sell us a dental service now, then you could be quite irritated by it. So I guess it's how people perceive that value. Moving forward from here, because obviously we're in a very unusual time where things have had to move fast and it's hugely affected all of your businesses. There are things that we've learned through this time of coronavirus in lots of different industries that I think people are going to take away and really want to use moving forward when we don't need to. We've learned a lot of great speed because we've had to. Ali, what do you think there is that Babylon has achieved at this time that you would like to take moving forward into the future?
Oh, so much. I must say, I mean, look, I'm old, right? So I'm in my 50s. And I never really thought that you could work as effectively and productively at home as we do now. I mean, there's just so much that we learned, and I hope we don't go back to what we had. I give you an example. The state of New York. We all know what is happening in New York. And the crisis, one of the greatest cities in the world, is going through one of its greatest public health crises. Mount Sinai, a partner, called on us and said, look, we had a partnership where you were going to launch in New York in December. Can we do this faster? And we kind of racked our brain and said, okay, we could do this in June, maybe July. And our teams did everything on this. And then the crisis got deeper. And then the team basically launched in New York 2 weeks ago, right? Or a week ago. That was launching in an entire new city with entirely new regulation systems, payment systems, you just name it, a whole new set of things in a space of a few weeks would have been unimaginable, even for an organization like us. So I think we've learned massive amounts. And look, Lara, whatever happens, and this crisis will go away. It won't go away, in my personal view, unfortunately, as quickly as people hope it's going to go away or believe it's going to go away. This will be with us for a while, but it will eventually go away. But when it goes away, we must remember we paid a massive price for this. I myself lost my father to this thing, my best friend, right? Not just my father. Thank you. But a countless number of people across the globe have done huge amount of suffering. There won't be anybody on this call who doesn't know somebody who has suffered personally. It will be an utter betrayal of these people if we go back to the way we worked or to the way we used to do it. I mean, just think about how much cleaner is our planet, is our air. Do I really need to jump on an airplane 4 times a week? It just didn't make any sense. And I think we all kind of sat back, and I hope we have come back to our senses that we can work differently and be as productive, if not more.
Yeah, we can only hope, can't we? We can only hope that this does something for our planet. Kate, how do you feel coming out of this crisis? Your platform has learned more, has learned how to treat people better, can be more productive and more useful for people. What do you think you're going to take from this moving forward?
Yeah, so I echo what Ali said on the work from home culture. It's been completely surprising how quickly we've adapted to it, how productivity is, continues to be at a high, how we've rallied for big projects if we've done emergency implementations, and just how rallied around our mission our team is. So, I think that's been a huge positive. And as we rethink returning to the office, it's definitely going to look different than it did, obviously, 3 months ago. I think another thing that's just very energizing right now is, particularly in the US, the healthcare model has just been so broken for so long. And so it almost feels like back in 2014 when we were building a healthcare product, and we were about to launch it and we didn't know what the market was going to do or say. I think now there's that same feeling because the care delivery model has forever changed. Telemedicine is going to be forever now further embedded into the primary workflow of healthcare. Physicians like it, patients like it. We just have to figure out the reimbursement model because US is still a fee-for-service system. And, you look at what's happening to the economics of healthcare right now in the US, and hospitals are losing something like $50 billion a month. It's not sustainable. And so I think that my team and I were just really energized to help have that dialogue around, with many of our partners, whether they're employers or health plans, some of the big buyers of healthcare, to really talk about what's the optimal care model. But then when it comes to women's and family health, which has been an underserved community, how do you make women's health better coming out of this? And how do you, for instance, embed mental health and lactation support in the core women's health model? Because that is what, drives to better outcomes for women.
Absolutely.
After they have a baby.
Yeah, and I think the provisions for mental health that have come out of this will certainly be something positive as well across quite a few platforms. I think now it might be time to take some questions from the audience. Do we have some in now? Yes, we have. Okay, here is our first question from Matt Eagles Havas. The use of telemedicine at Havas, sorry, I hope that I'm reading this correctly. The use of telemedicine has clearly increased during this pandemic, but many patients I've spoken to didn't even know it existed as an option for them. In the short term, how do we democratize digital health literacy, and ultimately, whose responsibility is it to do this, i.e. telecoms, healthcare providers, etc.? Who wants to deal with that?
I can take a swing at it.
Lovely. Kate, if you want to have a go, that'd be great.
Yeah, I mean, I think, telemedicine is an incredibly unsexy word. A lot of people had never used it before, or even knew what it was, as you mentioned. We're seeing utilization up, 50% across the platform. And then in areas like mental health, we're seeing it up 300%. And so what we are, what I think is really important is, one of the issues I think with telemedicine before this that the Maven model has tried to change is it's been very transactional and one-off. So it's like you need a drug, you need a prescription for a sinus infection, you go on, you don't even know the name of your doctor, they probably don't even remember your name, an hour later, and that's what it is. And I think now what we're and that's likely why a lot of people don't really know it as well, because there's no relationship there. And so I think what we've always tried to do and what we're starting to see is, how do you actually build an ongoing relationship with your virtual care team and your virtual providers, so that telemedicine is just how you receive healthcare in the way of other categories like transportation and food delivery. I mean, you go to a restaurant or you order takeout through an app, and that's very normal. You get in a cab, you order an Uber. And so,
yeah. Do you think people feel a little bit more sensitive though because of the topic? A lot of people are really willing to engage with telemedicine, but I've got an aunt who still won't buy anything online because she won't put her credit card details into a computer. So if you look at the whole population, obviously people have different attitudes, and healthcare may be something that a lot of people still feel sensitive about.
Yeah, we're at least within our population where there's not support in the existing healthcare system. We see people adapting out of need, not even necessarily want. So
yeah, but on the flip side of that, if you've got an embarrassing problem, it's probably better to deal with online rather than have to see someone in the flesh. Right, our next question comes from Alistair Cohen. He asks, how, if at all, sales approach has changed during. Sorry, I think there may be a little bit of a typo. How has the sales approach changed during the coronavirus crisis? Do emails work better than before, or is phone even more effective? How are health tech consumers' behaviors changing? Jean-Charles, maybe that's one for you.
I think in terms of sales, we have tried not to focus on sales in the last couple of months. I think our mission was not to try to sell our product more. It was to prove that our mission and what we are building is helping the community. And I think we have really shuffled our resources not to sell. What we have seen is that while doing that, we got a lot of inbound on a lot of feedback, and on our net promoter score has increased a lot, and all our customers have shared about us in a very positive way. So we have been growing in terms of number of users, in terms of number of leads, and in terms of usage of the platform. But I think it's going to be very interesting for us, and we go through employers mostly to see how healthcare is going to be a top of mind topic and a priority for companies in the future. I think for the first time, companies have really seen, employers have really seen that their job and their mission was also to take care of the health of the employee. It was something they had to do in the past, but right now they had to make decisions that were life or death. Like, when do I close my office? How do I manage that? And I think that is not going to disappear. And I think they are going to seek good partners to help them make those decisions in the future. They need to be
the scale of this has shocked everyone. Things like this have happened in the past, but we were living in this naive world that modern life was immune to it. And of course it's not. You could believe science and medicine were going to make it all okay before it was a problem, but it's not. So people are suddenly realizing how important their health is. And if people have never had health issues before, the chances are it wasn't at the forefront of their minds until now. So I'm sure everybody, employers and individuals, are all feeling a little more proactive than usual. Next up, we got a question from Jonathan Quinn, who I believe is going to ask the question himself. Jonathan, are you there?
I didn't know I was asking the question myself, but I'm happy to.
If you're happy to, that would be great. Thank you.
So there's quite a lot of evidence now of the potential for primary healthcare, GP consultations to move online. But I'm quite interested to see if the panels have a view on whether it's sort of specialist or secondary consultations can move online, and whether that's a next interesting area to look at.
Do you mean like cardiology, oncology, things like that?
Well, I think things which don't need in-person, you don't need to be sitting opposite the person to be able to see a rash or something like that. Something where it may be more, let's say, chronic pain management, or something where it's more discursive in a consultation.
Yeah, I think you already see that in a lot of different platforms today, at least in the US. So I was even talking to the chair of this health system 2 weeks ago, and he's an interventional cardiologist. And he was even saying he'd never used telemedicine before. Now he has to. And he's was raving about how, even many of his, chronically ill cardiology patients, not all of them have to come in all the time when they're getting their checkups. And so I think that what you're going to see is more and more secondary, specialty healthcare moving online. And it could even be as the regulations play out, you could have a choice as a patient between, do I want to go to Cleveland Clinic Cardiology or Stanford Cardiology or Geisinger Cardiology? And so there's going to be, I think, a lot more, major healthcare brands known for their clinical excellence, getting into that game where they have these, these hyper specialists in some of these, more, rare categories. Yeah.
Interesting stuff. Did that answer your question, Jonathan?
Yes, thank you very much.
Good, you're welcome. Got a question here from Anthony Cabrelli, who asked, what was the volume increase for telemedicine during the pandemic so far, and how are you dealing with volumes? Now, Ali, you did actually touch on this before, but how is Babylon dealing with the capacity of use that you must have experienced in the past couple of months?
Look, at the beginning was really hard. So we just saw all of a sudden a massive influx of patients for very good reasons. They were worried. But it was really interesting because we always argued that telemedicine is a wrong solution, because fundamentally, as I said before, it just puts a doctor behind a different medium, but he's still a doctor. And a doctor is as rare as anything, particularly when you look at some of the markets we're in, like Rwanda, where per capita has just a tiny percentage of doctors. So what we saw was we could take that learning that we had in countries like Rwanda and deploy it here, and I described it before, so I wouldn't waste your time again. But it really proved to me and to us that actually patients are not necessarily wanting to talk to a doctor. They want their problem solved. In the same way that if you go back 20, 30 years, we didn't really need to talk to a librarian. We just needed the information. And once we got the information, we fixed the situation. Now, that doesn't mean that we can get everything done without doctors. In reality, most doctors wouldn't want to do most of the things they do because they are not trading at the top of their license. Most doctors want to do at the best of their capabilities. And remember, Lara, and it's really important to remember because Kate just mentioned how maybe Geisinger can compete with Cleveland Clinic, but remember that all this healthcare system we got, and we got $10 trillion worth of it, serves 50% of the world population. That's it. That's it. Half of the world population has no access to doctors, right? Imagine if we can free up the doctors we have today so that they can serve the other 50%.
Yeah, that's something that I've heard that always gets touched on over all of my years of covering this sort of stuff. We always talk about what all this sort of telemedicine could mean for the developing world. How much progress has there been? How much have you seen happen over the past sort of 8-9 years?
Look, one of the proudest thing Babylon has ever done is that we work with the government of Rwanda, one of the poorest financially, culturally one of the richest, but financially one of the poorest countries in the world, to enable His Excellency President Kagame and his team to make primary care universally available to the entire country. Before we went in, it used to cost $5 to $6 to do a consultation. We managed to bring those costs down to $1 a consultation. At $1 a consultation, you can afford to give that to your entire nation. And President Kagame has. If Rwanda has, why not everywhere else? And if the Rwanda can do it now, why wait? As I said, these are not problems that cannot be solved. These are problems that just require the desire to get it done.
Of course. Right, our next question that we have here is Alexander Lebrun has a question, and I believe we can unmute him and he can ask it himself. Is Alexandre a man or a lady? I've said him.
Hey,
my apologies. You are a he. Good, there you are. You're definitely a he.
Yeah, my question was, how can we get continuity of care between the remote care and the in-person physical consultations? How to make sure, because they usually are different providers, how to make sure they actually work together?
Okay. Can I take this?
Yeah, sure, please do.
Sure. I'll be very brief. But Alexander, you don't have continuity of care right now. What continuity of care do we have? Your GP sends you, if you have a GP, sends you to a doctor who only idea of continuity of care is to read a note that was sent or sometimes lost to her. She passes you on to somebody else and so on and so forth. Where is the base unit in which keeps track of you? Who is the concierge that looks after everything you do? Who is your personal doctor? Now, I had this conversation once with one of the richest people in the world, and he said, well, I have it all, which is true, he does, but vast majority of the people in the world do not have that. So I think that it is absolutely right that digital should do as well as physical, but I think it's a sellout to believe that digital should just do what physical does. It should do it a ton better. It should not leave behind the 50% who don't get it. It should not allow those people who have such an uncontinuous silo-based healthcare to keep on to have these silos going on. And it should do with digital health, should do with delivery of a wholesome end-to-end healthcare that looks after you while you're healthy, as opposed to wait for you to have crisis. So I think the bar is a lot higher than the existing health system and what it delivers to us. So I just wanted to kind of touch on that. I think it's a myth to start thinking that what we have right now is a continuous personal human-based healthcare. And we should do a lot better than that.
Yeah, so Ali, would you like to see a future where all data, all of somebody's health tracking data, if they're tracking their heart rate, if it's necessary, tracking whatever is personally necessary to them, and all of their appointments with an online GP, obviously in the way that it is within the Babylon app, how you have a summary of your appointment. And then if they see a consultant, if they have to be referred on to a consultant for something, that would be in the same place. Are you looking to a centralized data model where everything will come together? And I mean, even internationally would be the big dream, so that anyone could travel and all information would become one. But how plausible is that?
Absolutely. So we just actually started with this, right? So we announced about a couple of months ago that together with the National Health Service, NHS, we and the hospital unit in the city of Wolverhampton, which is a great sized city, 300,000 people, the entire population, we just agreed a 10-year contract agreement where the entire population, we're going to serve them digitally first and do exactly what you said, bring all of their healthcare in their pocket and make it available to them in one go. Honestly, team, listeners, participants, think about if you have a mental health problem today in one of the richest countries in the world, UK, United States, what do you do? What do you do in today's system, right? You just wait until you have crisis, you self-harm, you attempt suicide, you end up in emergency. At best, we put you in a hospital for a little while. Eventually, you come out, but then we leave you alone again until you hurt yourself. The system we have right now is not a healthcare system. It's a sick care system. We wait for emergencies and we deal with those crises and emergencies. We can do a lot better than that. And that's what I mean. We should not look at this crisis and say we're going to go back and just add telemedicine now to the old system. We should fundamentally rethink the old system. Otherwise, this will be a crisis gone to waste.
Do you ever question how sensible it is for people to have all of their information themselves? Do you think it's always a good idea for everybody to be able to have access to all of their health information?
I am not a big believer in Big Brother and somebody else having all my information. I mean, look, Lara, go and ask Google to share with you all the information they have on you. I did it the other day. I was shocked by how much they know about me, and it has nothing to do with my healthcare. If I have given consent, I own that information. Nobody can sell it, nobody can trade it, as Jean-Charles said, and I can delete it or take it away anytime I want. Absolutely, I should have all that information available and all my healthcare known to me. Who better than me to look after me? I'm a big believer.
There's not a risk of people over worrying, becoming quite paranoid, and I suppose it's the thing that's always discussed with being able to track all of our vital signs, that people start to worry there's a problem when there's not, and become paranoid about keeping track.
I like to take the comparison with ATMs. When ATMs appeared, everybody was saying people are not capable to manage their own money. They need to talk to a banker to be able to get their money and to know how much they have. And I think our job as a healthcare company is just to step up the game. Of course, the raw data itself, it can be frightening, but it's not because it can be frightening that we should stop thinking and stop building. It's because it's frightening, because it's complex, that we have a job and a mission to make it intelligible, to make it really easy to understand, to make it friendly, and to put some empathy and design in the industry. And I think one of the biggest problems of the healthcare industry is that it was not user-centric in a way. It was not designed for the end user. And when you start designing it for the end user, for human beings, for citizens, you start to change the tone, how you explain things, and that make a huge difference.
Yeah, I think, in the US, there's been a big debate over this exact issue over the last year because the federal government, proposed interoperability rules where there is going to now be much more data sharing in the US. There just wasn't before. You as a patient didn't own your own health data. I agree with Jean-Charles, if you don't allow patients to be empowered, see what's wrong and then innovate around it, then it's, you're continuing to push ahead an existing broken system.
Thank you. I've got another question here. Another challenge during the pandemic is how to operate a business. Jean-Charles, Alan is known for its fantastic team building and how you operate. Can you speak of how you're managing your workforce and culture at this time?
I think it was especially mandatory for us to be able to run at 100% during the crisis. We didn't have the right to not be working because people were depending on us. And I feel then it's about how you build your company and your culture to be able to work remote first and to have people that can work from anywhere. And it's about, I think the DNA of what we are trying to build as a company is very linked to what we are trying to build as a project. It's to be extremely transparent internally. So you need to be able, when you are very transparent, to explain why you are making decision, and you want to apply that to your project, is to really distribute ownership. So how you give power to people to make decisions in the company. And what we have seen during the crisis is that we have been able to ship products like new features in a matter of days, like 3 days, 4 days, which was totally amazing just because the team had the power to do it. And that's the same thing we were discussing for healthcare. We need to give power to people to make decisions and to give them the tools to make decisions. So for me, I think companies such as healthcare company, we have also a mission to build an environment that is really solid in order to deliver our products. So transparent, distributed ownership, and taking care of our employees. And I think one of the biggest challenges that we all experience is that we are mission-driven company. So we wanted to deliver a lot for our user and very quickly. And we started to work day and night, like, and during weekends to deliver that. And you need to take care of the mental health of your employees as well. So how you find that balance has been something that was really, really important for us to see. We need to run, but it's going to be a very long race. So we need to pace ourselves to really focus on the most important things. And then it's the importance of focus at the end.
Of course. Well, thank you very much. I am going to move on to a question here we have from Amir Königsberg. What are the foundations that need to be put in place to make remote therapeutics for chronic diseases a real possibility? I think this is a really interesting point, because you can get a GP appointment online, but how about dealing with a chronic condition? I think, Ali, I'm sorry, I keep coming back to you, but I think this is probably a question for you.
Sure. Look at the way I just described we dealt with our coronavirus patients. So what we did was we gave them all the information they needed. So we busted the myths for them. We created blogs, we created videos, all the things that they needed to watch on their in front of them. Then if they needed to test or check themselves for anything, we created AI that could do that, or gave that to them to be able to check symptoms, to monitor themselves, all of those things. Then if they needed to kind of see if they're doing well or not, or monitoring or health assessment could help them. If they needed to talk to somebody, they could just chat 24/7 with an agent and figure out their problems, or nurse. And then only if they needed to talk to a doctor, they press the button, within minutes they talk to a doctor. Look at what happened there. As I said, our need for doctors significantly reduced, but our patient satisfaction, those people, when you ask them, why are you not using doctors? They said, because we get everything we want. It's there 24/7 all the time. Now take that and say, what if, forget about coronavirus, but what if we did that with somebody with a mental health issue? What if we did that with somebody with a diabetic issue, with a COPD issue, with asthma? Instead of waiting until they have an attack, if we monitor them all the time, and ahead of that, we could just come in and say, hey, we can notice that your lung capacity is reducing, or you're starting to have an issue. Could we help you out? How amazingly different that would be. And I think that is what we now need to do. Primary care is 7-8% of the cost of healthcare. About 40% of our cost of healthcare is chronic conditions. And as I said earlier, 70% is actually predictable issues. We can deal with this in a very, very different way. Look, the future of healthcare, it's all of a sudden has become a lot brighter. What is going to stop us? It's going to be our own courage, and the courage of the authorities and those who have to buy on behalf of the patients or users to use it. Patients are already there, and they will use it in very large numbers. I'm incredibly optimistic. I would be amazed if we went back to what we had, and I think we're going to move on really fast. And there isn't a healthcare professional or a health system I talk to who even considers going back to what it had. Everybody now wants to use what we learned during the COVID-19 crisis, and once this is over, to apply it exactly to the questionnaires, to Amir's question, which is chronic condition.
Absolutely. And I think one of the pivotal points that you made there was the ideal scenario would be that any chronic condition was constantly monitored, and if there was a problem, an alert would be created and it would be dealt with. But in terms of staffing that from a medical perspective, how plausible is it? Longer term, maybe it's something that could be automated, but initially, it sounds like it would take a lot of people power to have somebody available 24/7 to instantly be able to react to a problem. How plausible do you think it is to get that in place? Jean-Charles or Kate, do one of you want to pick that up?
Yeah, I think what we're seeing today, Livongo is a great example of this, which manages a lot of chronic diseases. You can actually staff a great blended model of 24/7 support. As well as a lot of machine learning and personalization and AI to really kind of guide people on a treatment program and really kind of drive that behavior change. But then of course, if somebody needs the support, they should be able to talk to a human. And so, I mean, what we found as well, pregnancy is not exactly a chronic disease, but it's certainly a condition that one has for a little bit of time. And it's not like somebody has needs every single day. So you can actually run a really efficient 24/7 staffing model and serve all of your customers' needs.
I've got another question here from Alexander O, which is a question for Ali. But I'd actually like to open this up as a more general question for all of you. The question that Alexander is asking is, what is your experience of telehealth and the adoption rate in the NHS, and how has the pandemic impacted digital adoption? But I think actually for all of you, how has the pandemic affected digital adoption? I will let Ali answer it first, but it would be nice to hear from all three of you.
Alexander, telehealth is done. It really is now everywhere. And it was always easy and it should have been everywhere. It just didn't. There's a wonderful company in London who just turned back the other day and said, look, we just built a platform for video conferencing from GPs over a weekend. And they did. And we built one over 2 days that we freely made it available to everybody else. Just think about this. We're all technologists on this call. Something that you could do over a weekend, it must be such a low barrier to entry.
But it's something that you can do over a weekend, not something your average person can do over a weekend.
But anything, okay, so somebody else can do over a week, but it doesn't matter. The barrier to entry must be so low if you could do that. This was never a technology problem. I think it was always a cultural issue. And I think now increasingly people are going to move to that. NHS has been fantastic. I'm not just saying it because they're my client or many of the people in there are good friends. I'm saying it because they genuinely, can you imagine if 3 years ago, 4 years ago, before we had all the issues with security and the systems in NHS, if the investment that went into the technology in NHS didn't happen in the last 2 to 3 years or in that period, how much more difficult would it have been to do what we've done now? I think we are at the beginning of a new dawn, but I just sound like a broken record. It'll be such a shame and it'll be completely wrong to just stop here, just say, okay, now we're going to do telemedicine. That's just done. It's finished. It's gone. The barrier to entry to that was very small. We should just assume it's there. What we really now need to do is reinvent the model of the delivery of care to go from this reactive, transactional, crisis-based nonsense to a proactive model that keeps people healthy so we don't run into expensive crisis after expensive crisis. That is the frontier we need to solve now. The technology for it is here. We just need to get it done. And it's a huge business for the digital companies, by the way. Some people will build some of the world's biggest companies on the planet on the back of solving this problem. This is a $10 trillion industry, bigger than any other in the world. And digitization can create some of the world's biggest companies. So for those entrepreneurs out there who are in companies who is not doing well, or they think, what am I going to do next? Or they're on this call because they're thinking that, how do I think of my next thing? Believe me, there is so much to build in this industry, and some people will do phenomenally well. So please come, please join the sector, and please put your genius to make healthcare accessible, affordable for every human being on earth.
Oh, Lara, you're on mute.
Sorry, I had a bit of a crisis. My husband kept on calling me. Jean-Charles, can I just have a quick response from you on that as well?
I think Alice said it all. Like, the opportunity to transform the system is really huge, and it's only the beginning. Like, telemedicine software for GP is going to be a commodity. Every GP is going to have that software, and they are not even going to be willing to pay for it. I think it's just going to be the basic setup of a GP office. What's going to happen is, indeed, how do we provide a continuity of care that comes from proactive care to the delivery of care in case of complex problem, and how we remove the friction to navigate that system for users. And I think that's really the thing, is the healthcare system is frightening because it's complex and because people have lived on its complexity. Complexity to know how to live well, complexity to get information when you're sick, and to access to the best care. And I think the big job of health companies is just to simplify that and to make that accessible to everyone.
And
as
Kate,
Ali said.
Thank you very much, Jean-Charles. We're going to need to tie things up here. Kate, what percentage increase in use do you think you've had since the pandemic began?
Yeah, so we've seen 50% across the board and 300% in certain areas like mental health. So overall up, and this is actually with a lot more physicians as well. We have expedited provider applications. So very, very, utilization much higher, and satisfaction, excitingly, and quality has stayed the same.
Well, thank you very much. Thank you to all the panel. Ali, Jean-Charles, Katherine, thank you very much. And thank you to everybody who has been listening.
Thank you.